Hello, everyone, and welcome to another segment of the PF Warriors video series, Lessons Learned, sponsored by FibroGen Incorporated, a leading science-based biopharmaceutical company discovering and developing a pipeline of first-class therapeutics. I'm Shelley Mathis, Executive Director of the PF Warriors International Support Group. We will be posting these video shorts weekly to educate and inform you of things going on in the world of pulmonary fibrosis and interstitial lung disease. Today, I'll be interviewing Dr. Susan Mathai, advanced lung disease and pulmonary transplant physician, Baylor Scott & White. Education, Yale University School of Medicine, Harvard University undergrad, internship and residency at Mass General Hospital, pulmonary and critical care fellowship at University of Colorado. Thank you, Dr. Mathai, for joining us today.
Thanks for asking me to be here. It's a pleasure.
We have many probing questions for you today, but one is, when you were a medical student, you probably observed deathly ill patients, some of whom probably even died while you were observing them. Then you became an intern and physician, and you were responsible for life or death issues with a patient. I've often wondered how you medical doctors make that pivot, and what kind of reckoning must that be like for you?
Well, what I would tell people, and especially anyone who's thinking about doing medicine or going into healthcare, is that the reality is there's no real way to prepare yourself for that transition. It's sort of similar for those of us who have become parents. There's no way to explain what becoming a parent is like until you actually do it. No matter what you read or observe, it's really different when it's really you in the decision-making spot. And so I think for most of us, medical school is really exciting, and you learn so much and you're exposed to so much, and you certainly do become really close to many patients that you take care of as a medical student. But this is why internship and residency is such a big transition, because you go from being an observer and a helper to a person who feels that burden and that weight of decisions and that weight of responsibility. And I think it's really hard. There is not an easy way to do that other than just experiencing it and spending a lot of time reflecting on your successes and what you feel like are failures sometimes, but are opportunities to do better the next time. We all have patients that we wish we could have done something differently, or that we had made a slightly different call or had a different discussion. I think all of us live with that. And that's part of what makes this job really hard, but part of what makes it rewarding. And because we go to work every day and know that what we did and our words and our actions really mattered. But that comes with a lot of responsibility. And it's part of the reason why there can be a lot of burnout in nursing and in being a doctor or other provider, because that responsibility can weigh on you. And many of us, myself included, really are thinking about patients and thinking about decisions and next steps for patients, even on weekends and at night, and sometimes when we can't sleep at night. And so it is hard. It's why there's a lot of burnout in medical care.
I can't imagine the weight that you must feel when you're really dealing with very sick patients. And I've come to believe that pulmonologists, especially those of you dealing with some of the very most complex interstitial lung disease patients, have the hardest jobs. Now, your patients don't get well. They can do better, they can feel better, they can operate better, but they're possibly going to be your patients for the rest of their lives. From what I read on our Facebook page, patients seem to love and adore their pulmonologists. It's not like the guy who put my new knee in. I saw him a few times. He put the knee in. I'll never see him again, I hope. But with your pulmonologist, you really do become very connected. And I'm wondering if it's the same for the doctor, for the pulmonologist. Can you comment on this?
Oh yeah, for sure. I think those of us that choose to have practices that are more outpatient. So when you become a pulmonologist, you train in both critical care, which is the inpatient ICU side of things, and in pulmonary medicine, which has an inpatient component, but also is primarily an outpatient practice. So pulmonology is where we take care of ILD patients, emphysema patients, cystic fibrosis patients, bronchiectasis patients. And so that is in many ways, when I talk to younger people thinking about doing pulmonary and critical care training, I actually talk about it as being one of the greatest fellowships to do, because you get that inpatient side of things, which is really exciting, life and death, ICU, breathing machines, make life support, making really big moment by moment decisions, but you also become trained in these long-term relationships with patients. And every doctor who goes through that training, as they craft their own careers, will find the right mix of those two things for them. Some of my colleagues go do only critical care. They choose to do that. That's where they feel that they're making the best impact. And then some of us, like myself, choose to have careers that are more outpatient, where we have these really long relationships with patients over many, many years. And I think for those of us that choose the outpatient side of things, I think that's what really keeps us passionate about what we're doing, is that we really get to know patients and their families, as you're saying, usually over many years, because we're walking with them through what is usually a lifetime or at least long-term illness. And a lot of times what I tell patients at the beginning, when we first meet each other and are working through their ILD or pulmonary fibrosis diagnosis and plan, is I say, I'm telling you a lot right now, but this is the very beginning of a long journey we're going to take together. And I think that being part of that journey is what keeps many of us excited and, excited to get up and come into work every day, because we're really part of that for patients.
Yes, it can be a long journey. Thank heavens for all the new treatments and medications and therapies that you all offer now, that we're all very grateful for. From your point of view, what are some of the things you try to get your patients to do that they could work harder on? Because I imagine patient compliance is pretty important in this role.
It is, but I think most of my patients, are for the most part pretty interested in and committed to their ILD medication. Sometimes we have to work together to find the right medication for a person, because each person can have side effects that really vary. Like, everybody's different. That's certainly one of the lessons I've learned, is that even though we write about diseases or study diseases by grouping lots of patients who have certain ILDs together, in reality, every patient's ILD and hence their journey and our treatment options and the treatments that make sense for them really need to be tailored to their specific case and the way their body reacts to every medication or treatment we try. So that's one thing. But I think if I had to pick one thing to kind of emphasize, is that for most of our patients, just like you said, this is a long-term illness. And so we need to be focused for sure on optimizing their care for their pulmonary fibrosis or their ILD, but we need to not neglect the rest of their body. And that includes eating nutritious foods, avoiding excess weight gain, staying fit in the ways that we can, even if we're limited by our lung disease. Because the reality is, the more fit the rest of your body and organs are, the the more you're going to be able to do as a patient with the lungs that you have, even if those lungs are imperfect. So a lot of my patients, if they're watching this, are probably not smiling to themselves about how much time I spend with them, about talking to them, about staying as active as you can. Of course, everything within reason and in a safe way, but staying active, getting up and walking around and doing, even if you can't lift weights the way you did when you were younger and healthier, doing like lower weight exercises and things like that to keep the rest of your body going. We also can't ignore things like routine cancer screening or heart health. So taking care of your heart and your lungs are very, very closely entwined. And so making sure we're not ignoring the rest of the body, even though our focus in our clinic is certainly the lungs. I think that's like one of the biggest messages that I would put out there, especially as you're saying, Shelley, we're in this era of what we hope are a lot of new potential treatments that will continue to make this disease of ILD something that is more of a chronic illness with a better prognosis, but that means we need to take care of the rest of our body too.
That information sounds so good to me, being a caregiver for someone with pulmonary fibrosis. Finally, Dr. Mathai, is there anything you've learned from working with patients that you wish you could go back and tell your intern self back after you got out of medical school?
That's a really good question. I think for sure one of the things that makes medicine really exciting and a career that I think I'm really thankful to have is that things are changing all the time and we are constantly learning. So yes, some of us are ILD experts in the sense that we spend almost all of our time professionally taking care of ILD and pulmonary fibrosis. But the reality is, just as I said before, every patient's different. And there are going to be times where unexpected things happen, or a patient's presentation is really different than the standard or textbook. And I think being open to that and staying curious, which I think is something I've learned how to be, but also to kind of, forgive ourselves a little bit when we have to say, wait a minute, and take a beat and say, we need to look at this case a little differently. I think when you're younger, you hope that there'll be a day where nothing surprises you, where everything that happens to a patient, you'll be able to like immediately understand and be the expert on. And the reality is that what makes this field great is that things are changing and there are going to be new things to learn every month, every year for sure. And I think ILD in particular has really taught me, and I'm sure all of my colleagues, a lot of humility, because there have been so many changes about the way that we approach things over the course of a few years. And there are treatment options that we didn't necessarily think helped people a few years ago that now might make sense based on new data. And so we have to be humble about that and know that we may be coming back to patients and saying, well, you know what, there's this, I know I said this, but actually we have new evidence or data to support looking at this a little differently. And so I think that humility and not being afraid of that change is an important lesson to learn. And I think all of us as doctors are constantly confronting that. I think another lesson that I've learned, that especially being a doctor for ILD patients, is that there's a certain amount of uncertainty that comes from starting a patient journey with someone. And what patients and their families really value is being straightforward. So they want their doctors to be honest with them. They want them to be straightforward with them. And part of that honesty and straightforwardness is us needing to acknowledge that there is some uncertainty, that every patient's journey is a little bit different and can be unpredictable, but that patients will appreciate that honesty about that uncertainty. And I think sometimes when you're a younger physician, it's harder to express that certainty, or you feel that that is a failure when we can't tell patients a definite answer. But the reality is patients and their families need to know that there are things that we cannot predict for any individual patient, but what they do want to know is that you're going to be there with them for that journey. And that's what's really important.
Thank you so much for those lessons that you've learned as a pulmonologist. We really do appreciate your time and your wisdom that you've shared with us. And thanks to FibroGen for sponsoring these programs. Join us next week for another segment of Lessons Learned series. Goodbye for now.